So the bony surface anatomy for the elbow is we're gonna start with the lateral side, and we're gonna come in and we're gonna find the deltoid tuberosity, and we're gonna follow that down. So the ridge that I feel just distal to the deltoid tuberosity is the lateral supracondylar ridge. This is fairly superficial compared to the medial. As we come down, it's going to start to widen a little bit. So I'm going to mark this until we get to the end where it ends at the lateral epicondyle. The lateral epicondyle is a 5 millimeter by 5 millimeter box, and we're going to find that's going to be a really important structure that serves as the proximal attachment for several of our wrist extensors. So I'm going to come in and I'm just going to draw a line here. So this is, again, the lateral supracondylar ridge is quite superficial compared to the medial. As we get a little closer and we come down here, it's going to start to widen until we get to our lateral epicondyle. Here. And here we are. Now, we're going to find our capitulum. So our capitulum, if we come in, that's more of a circular structure that we're going to feel on the lateral aspect of the elbow. And when I ask him to pronate and supinate, I'm going to feel that the capitulum does not move. So I'm going to follow that around and I'm going to trace that out here. So we have our capitulum and we have our lateral epicondyle. Then we're going to find our radial head. And our radial head, if we drop down, we're going to feel the joint line between the proximal aspect of the radial head and the inferior portion of the capitulum. So when he rotates his forearm, I can feel that radial head. I'm going to keep him in a pronated position because that's going to make that proximal edge of the radial head most prominent. So I'm coming in here. And we're going to be able to identify, the medial edge is going to be the most difficult to identify because of all the soft tissue, but we're going to come in and draw out, here is our humeral radial joint line. Now, to feel the distal portion of the radial head, I'm just going to turn him a little bit in a neutral position, and that's going to make that more prominent. So the anatomy on the lateral side of the elbow. We have the lateral supracondylar ridge that widens, ends at the lateral epicondyle. The capitulum, which is a more circular structure that doesn't move when we rotate. And then we have our radial head. Coming in, our radial head, the proximal edge, our humeral radial joint line, as well as the radial neck. Now we're going to go to the medial side. So if we come in here, now the difference between the lateral supracondylar ridge and the medial supracondylar ridge is the medial supracondylar ridge dives very quickly. So we're going to palpate, we'll feel, here's our medial epicondyle. Okay, I'm just going to mark that. And now, as we go proximally, I'm only going to be able to palpate about 1.5 centimeters to 2 centimeters before I lose that. And that's because of that sharp angulation that medial supracondylar ridge takes. So we've identified here the medial and the lateral sided bony anatomy. When we bring the elbow up at a 90-degree position, if we see here's our olecranon, we form what we call an isosceles triangle between the medial and lateral epicondyles and the olecranon. So we have two equal sides, the distance between the olecranon and the lateral epicondyle and the olecranon and medial epicondyle.